All right, looks like everybody has gotten in our virtual room. Again, welcome everyone to the STAR Center Workforce Professional Development Series. This is session 3 out of a 4-part series, and today we are going to be talking about using the National Health Service Corps to recruit clinicians. Next slide, please. My name is Suzanne Spear, and I'm the Senior Director of Workforce Development here at ACU. I am joined by several of my colleagues today, and one of which I will call out just because she is our tech guru and on here to make sure that anything tech related is answered. So feel free to email or chat Mariah in the very center of this slide here, and she will be glad to help you and get everything going for you. Next slide, please. So most of you all know who the Association of Clinicians for the Underserved is, but if you don't, that's okay. We're glad you're here. So ACU, otherwise known as the Association of Clinicians for the Underserved, was created about 26 years ago by alumni of the National Health Service Corps. We've changed a little bit over the years, but our mission remains the same, and that is access to care for underserved and historically underserved populations, as well as caring and supporting the clinicians that serve those populations. We have several programs that you can read all about on our website, which is clinicians.org, and we have several different programs. As I mentioned, we have a suicide safer care training program for both health center clinicians as well as staff. We have a vision services program. We have lots of different things going on here at ACU, but the program that we are here to because of today is our STAR Center. Next slide. And our STAR Center is our National Training and Technical Assistance Partner cooperative agreement through the Bureau of Primary Health Care. We were initially awarded our first award in 2014. So we are in year 9 of this work. And what we are here to do at the STAR Center, which stands for Solutions, Training, and Assistance for Recruitment and Retention, is to create training and technical assistance opportunities around clinician recruitment and retention. We have a separate website from our ACU website, and that is chcworkforce.org. Everything that you see on our website there at chcworkforce.org is absolutely free to you. It's already been paid for by the Bureau of Primary Health Care. And if you haven't been there lately, we hope you'll go by and take a look at all of our resources. Next slide. Just some housekeeping items. So this session is being recorded, and it will be sent, a recording will be sent to everyone that registered, as well as it will also be posted on our website as well. Feel free to use the chat box to ask questions and share thoughts during the session. We welcome that, even though we are in a virtual room here, we're not actually can see one another well. We welcome your thoughts and insight as we go along, as well as questions. And then again, feel free to email Mariah or chat her in the chat box, and she can help you. Finally, please complete the session evaluation at the end. We appreciate your feedback, and also BIPIC appreciates the information as well. Next slide, please. So just as a reminder, and if this is your first session of our professional development series, just a little bit of a reminder here. So the reason that we have these sessions in our workforce professional development series is really to provide a space for professional development for you who are doing workforce work, either at your health center or at your primary care association, and also to provide a space for collaboration and support in your workforce efforts. There isn't a lot of really opportunity to have professional development. So it is our hope that through these sessions, it will provide you not only input and insight for different workforce subjects that are affecting your work every day, but also allow you to collaborate and hear from your fellow colleagues and just see one another in this virtual room. Next slide, please. So today, I'm so excited to welcome two of my ACU colleagues. So first, we have Molly Meinbrace, and she is our Associate Director of NHSC Education Programs, and then our Executive Director, Amanda Pierce-Kelly. And so they're going to be walking you through all about the National Health Service Corps programs, loan repayment, HPSA scores, and all of those fun things. So without further ado, I'm going to go hand it over to Molly. Thanks so much.
Thank you, Suzanne, for that lovely introduction. I'm happy to be here with you all and Amanda presenting on how you can use the National Health Service Corps to recruit clinicians at your site. I did want to go over our learning objectives briefly. We will explain the benefits of being a National Health Service Corps approved site, then quickly describe the application process, challenges onboarding new National Service Corps clinicians, and also introduce you to the National Health Service Corps Empowering Clinicians for Resiliency and Transformative Care initiative that ACU is involved with HRSA, and then look at identifying ways clinicians and sites can participate in that initiative, and then also brainstorm ideas to support National Health Service Corps clinicians. I would like to know a little bit more about you all, who's in the room today. So if you're able to use the chat, go ahead and tell us what role you have in your organization. I know we've got representatives from FQHCs here today, PCAs, and maybe some other organizations. I'm going to try to open my chat and see if I can see what folks post. So we've got executive director in FQHC, some HR folks, director of recruitment, that's great. Oh, workforce program director, okay, yeah. Excellent, thank you so much. So we're really happy to have you all here. You're the perfect folks to be here today. And then were there any PCA representatives? I couldn't tell from the chat.
It looks like there are several here as well. Yeah.
Oh, I see, yes.
Definitely a mix. Yeah.
Rhode Island, okay, gotcha. All right. So I'm also curious if any of you have helped with a National Health Service Corps application in the past. If you're from a PCA, have you helped health centers apply to be an NHSC approved site? You can just put like a yes or no if you want in the chat. I see a no. And some yeses and nos. Okay, we have a little mix here today. I mean, that's great. So hopefully the folks who've not will learn some, and the folks who have may learn additional information. And so how many of you at the health centers have been involved in recruiting, onboarding, and supporting National Health Service Corps participants when they do come to your site? Okay, lots of folks who are supporting those clinicians. That's great. All right, well, thank you. That really helps us get a feel for who's here today and who we're talking to. Just a brief background about the National Health Service Corps. It is operated by the U.S. Department of Health and Human Services, HRSA, and the Bureau of Health Workforce. As of September 2022, there were 20,215 participants nationwide in service. There are also 3,493 participants who are still in school, so they're part of that scholarship program or the Student to Service Loan Repayment Program. They're providing primary care, dental care, behavioral and mental health care, and midwifery services at almost 21,000 National Health Service Corps approved sites across the country, serving approximately 23.6 million people. So this is a huge program. We have folks all over the country in rural areas as well, providing lots of different services. So what are the benefits of being a National Health Service Corps approved site? You can recruit primary care clinicians. That's the biggest one. There is a minimum 2-year commitment. So you've got folks for a couple years. If they're part of the National Health Service Corps Scholarship Program, they have to commit to serve the same number of years that they received scholarship assistance. So it could be more than 2 years, about 2 to 4. And then if they're part of the Students to Service Loan Repayment Program, they have to serve in full-time capacity for at least 3 years at an NHSC approved site. And those folks do have to want to work in a health professional shortage area. Most of you probably know what that is at this point, and I'll just say HPSA from this point on. But those HPSAs are geographic areas, population groups, or healthcare facilities that are designated by HRSA as having a shortage of primary care, dental, or mental health professionals. And you can find more information online about that definition, and later on, or now, Amanda will chime in and say a little bit more about it.
Sorry. Can you guys hear me okay? All right. You would
Yeah.
think after all this time that I would be used to Zoom and getting myself off mute, but I find that for some reason the last couple of days, I'm clumsy with my keyboard. So a couple of things that I want to share with you guys. I was really lucky to be able to connect with Dr. Luis Padilla last week, who heads the Bureau of Health Workforce, and he had some interesting feedback, which I'll get into in a minute, about National Health Service Corps and sort of where things are, where we're headed, but also like how the program is being leveraged. But I think one of the most important factors that I wanted to share with you guys in terms of how to leverage National Health Service Corps, but I think some of the questions that come up is around HPSA scoring calculation. And I guess I would call out a couple different factors with this. In past years, not so much the last two, but in past years, I know, at least in our conversations, oftentimes the HPSA scores tend to be a barrier for people engaging in the National Health Service Corps, or the assumption that, okay, my HPSA score does not qualify me to engage in National Health Service Corps. I will say in the last couple of years, it's been different because the way that they're able to fund applications around HPSA scores is based on the availability of resources. So fortunately, there was a huge infusion of resources into national and funding into National Health Service Corps in the last couple of years through the ARPA funding. So they were able to fund way down in terms of HPSA scoring. But let me pause for a second and just check in with you guys about, and I guess it's a fair question to ask, how many of you feel comfortable and can speak easily to how the HPSA scores are calculated? So that was something that we wanted to speak to today. Some of you may already have this down, but just as a refresher, there's a formula that they use in terms of how to come up with the HPSA score out of 25. So one of the first things that they look at is population to provider ratio. And there's a 10-point max that's associated with that category and that kind of equation, that part of the equation. The next thing they take into account is percent of population below 100% of federal poverty level. There's a 5-point application to that part of the formula. Then they take into account infant health index. So based on the IMR, or the low birth weight rate, that also serves as a 5-point formula or application for part of this formula. And then the final piece is travel time to the NSC. And that's also 5 points. So collectively, it's out of a score of 25, but these are the different factors that they take into account in terms of how to calculate the HPSA scores. A couple things that I would call out is that if you have not, and Molly, feel free to chime in, if you have not been in touch with your primary care offices, it is very worthwhile to check in with them about this. Oftentimes they can support in not necessarily adjusting the way that the score is calculated, but helping you to look at the different factors. And there may be things that you can do to adjust at your health center, or at least things that are worth considering in terms of, okay, how do we make this evaluation? I think the other thing is that right now we're still in a period where there is a great deal of funding going into National Health Service Corps. It's coming down, but what I can tell you is that they funded down to a HPSA score of 3 in the last cycle. And what I heard from Dr. Padilla last week is that they only had 400 applications come in at a HPSA score of under 13. Only 400 out of all the health centers and all of the other entities out there, just 400. And there were only 100 that came in, I think, at under, I want to say 7, and I might be misquoting him on this, But what I took away from that is there are a whole lot of health centers, there are a whole lot of entities out there who could be accessing National Health Service Corps funding and support, regardless of their HPSA score. And unfortunately, they're either not completing their application or they're not submitting an application, period. So again, a couple of things that I would just call out is that we're still in that space. I can't guarantee that they're going to have the resources to fund down to a HPSA of 3. But they did have the resources to fund down, he said, all the way down to a HPSA of 1 last year. And it was just that they didn't have the applications. So what I would just really, really strongly urge is that if you are a health center, make sure that you take advantage, regardless of your HPSA score. If you are a PCA, we're happy to work with you, but I would also say just really encourage, I know you guys are already doing this, but do everything that you can to make sure that your health center members and others know that there is greater access to National Health Service Corps support right now than there has historically been in the past. And then that final piece, as I said, is that the primary care offices can be really helpful. And so if you haven't been in touch with them, I think the very first thing to do is just reach out, ask for a 30-minute call, do an introduction, but check in with them on resources that they may have to support this, but also are there things that they are working on in the context of HPSA scoring and looking across the entire network in their state and their region to be able to support this. So Molly or Suzanne, anything that you guys would add to this?
Someone in the chat did ask if PCAs are able to access the HPSA scores of the CHCs through the PCO, and it looks like I typed it in the answer in the wrong place, but yes, I do believe they should be able to get those scores from the PCO.
It's a really good question, though. I think that sometimes having that information can be really helpful, especially in helping to guide and work with your health centers around where they are in the process. The other thing that I've noticed is that there's different programs within the National Health Service Corps, right? So basically you're looking at mental and behavioral health, dental, and then medical. And so what I've seen with a lot of health centers is that they may leverage National Health Service Corps for medical, but they're not leveraging it for dental, or they're doing dental, but they're not doing medical. And so I think, there's just a great opportunity to leverage the program maybe in a greater way than we have been. And certainly, like I said, the comments that I heard from Dr. Padilla last week support that. And I also know that Bureau of Health Workforce is really eager to support folks too. They've been doing a lot to try to help with, and they recognize that part of what they're seeing is that people begin the application, but they're not completing. And so I think that there's a job and some support that we can do at ACU, but I think even more so the PCA and then BHW is sort of poised and have put out some resources to support folks in that so that they can complete the application. And then I think that also makes the case for why we need to continue with supporting the program. I'll stop there.
I'm going to quickly answer this question in the chat before I go on. Thank you, Amanda. So someone's asking about application and HPSA scores. So I believe Amanda was talking about the application to be a National Health Service Corps approved site, and the HPSA score is calculated based on those factors that Amanda mentioned. Does that make sense, or does that answer your question? I am going to move us along, unless, did you want to add anything else, Amanda?
No, I don't think so.
Oh, okay. Thank you so much for that. So just continuing on about the benefits of being a National Health Service Corps approved site, you do have support provided by the Bureau of Healthcare Workforce, the Division of Regional Offices, and as Amanda has been talking about, the state primary care offices. They are an amazing resource. They can help you with all the details of the applications and recruiting clinicians. There's the Health Workforce Connector. I took a little screen grab of that website, but it's where you can go on, you can create a profile, add, pictures, details about your site, anything that you'd want a potential clinician coming to your site to know about you, so that when they're looking for places to go, they'll be informed. And then it's also where clinicians who are looking can go look at sites. So you can, search for applicants, post jobs, and then also network with other National Health Service Corps approved sites. So what clinical disciplines are eligible? For the scholarship program and the Students to Service Loan Repayment Program, this is just open to physicians, nurse practitioners, nurse midwives, dentists, and physician assistants. So these are the folks who are in school and then planning to work in a HIPSA healthcare agency, or they're just about to leave school and go into the loan repayment program. So they're all very new clinicians in these two programs. And then there's some other programs, the loan repayment program, the substance use disorder workforce LRP, I'll just start saying that from now on because it's a lot of words, and then the rural community LRP. So all of the clinicians I just mentioned are eligible, plus health service psychologists, licensed clinical social workers, psychiatric nurse specialists, marriage and family therapists, licensed professional counselors. That's just for the general loan repayment program. And then for the substance use disorder one and the rural community one, even more disciplines are eligible. And I'll show you on the next slide a little bit more about that. But I did want to mention each site can hire one scholar and one S2S LRP, the Students to Service LRPs, per discipline, per site, per year. Those are more limited, I believe, because they're just coming out of school. But for the other loan repayment programs, there's a lot more opportunity to have folks at your sites. So there's a really helpful graphic on the HRSA website or the National Health Service Corps website comparing these programs, who's eligible, and who's eligible for all of them, and then the specific ones for each program. Also, what the award amount is and the service commitment required. So when you're applying to become a National Health Service Corps approved site, you have two options. There's one for sites who have never been approved, and there's an option for sites who've previously been approved and are currently inactive. And so you'll pick the one that's appropriate for you. Each site does have to submit a separate application. So if you're a healthcare agency with 10 different service delivery sites, each site has to submit a separate application. And then you want to ensure you're eligible, that you're in a primary medical, dental, or mental health HIPSA, as we discussed before, and that your site meets criteria. I'll show you in a couple slides what some of those criteria are, but there's a really helpful site reference guide on the website. This is a clickable link, so when you get the slides, you can access that website. There's also the customer service portal. That's where you actually go and fill out your application. And once it's submitted, it takes about 6 to 8 weeks for approval. As Amanda mentioned, the HIPSA scores take into account the population to provider ratio, percent of population below 100% of the federal poverty level, and travel time to the nearest source of care. I think she mentioned a couple other factors, and someone mentioned in the chat that depends on the type of, I think, clinician that you want, or do you want to speak to that, Amanda? Yeah.
I was just going to say, so the scoring formula that I mentioned, that was, it's a kind of a quick rundown, but that was specifically for medical. And then basically there's a scoring formula for dental and then for mental and behavioral health. And I can go through this really quick just so that you guys can hear them and also just understand the difference. And then actually I want to share kind of a policy change and I think a continued commitment on the part of the Bureau and HHS. But so for dental, the way that they calculate the HIPSA score, it's a total score of 26. Again, that population to provider ratio is the biggest factor. That's 10 points for that one. They then look at percent of population below 100% of FPL. In the dental category, that's another 10-point consideration. They look at water fluoridation status. It's just a 1-point consideration, and then travel time to NSC. So, and that's 5 points. So that's the dental calculation. Again, it's a total of 26. And then for mental health, there's actually a lot, but I do want to walk through these because I think it's worth everybody hearing. And there are some key things in this that I want to call out. So for the mental health scoring, it's a total score of 25. Not surprising, first two are consistent. Population to provider ratio, that's a 7-point account there. Percent of population under 100% of FPL, that's 5 points. Then they look at the elderly ratio, that's a 3-point consideration. They look at the youth ratio, 3-point consideration. They take into account alcohol abuse prevalence, that's a 1-point consideration. Substance abuse prevalence, that's 1 point. And then travel time to NSC. So not surprisingly, what they're trying to do for each of these categories is look at the needs and the intention behind the clinical service line. So that's one thing. The other thing that I'll call out is that I think it was, I want to say it was 2 years ago now. I'm sorry, because the pandemic has me still in a little bit of a blur about when things happened. But it wasn't so long ago that the Bureau was very committed to and did some revision around how to incorporate and consider health equity standards in how they're calculating scoring. And occasionally they will do that. They really try hard to make sure that the calculations and HPSA scoring is taking into account all the factors that we know to be very important in terms of how this is driven. And so it was just a few years ago, two or 3 years ago now, that they did the last sort of request for information to help guide how they might revise their HPSA scoring formula. But it is something they do periodically. ACU remains very engaged in that, but I would just encourage you guys, like this is another one where staying in touch with your primary care office can be helpful in this, because they certainly will weigh in. Staying in touch with us at ACU, but also for you to be thoughtful about the kinds of things that are important to be considered in these formulas going forward. So I'll turn it back to you, Molly.
Thank you, Amanda. I was just responding to someone really quick in the chat. There we go. Yeah.
Got some great convo in the
Yes. Okay. Thank you for explaining all that, Amanda. That's super helpful. I'll keep us going. So there are some auto-approved sites. This title is a little bit misleading, but it doesn't actually mean you're automatically approved to be a National Health Service Corps approved site. You still have to submit an application, which has to be reviewed and approved, but it means you can submit an application anytime. So there's specific times a year where they open up applications for all agencies. But if you are any of the types of agencies listed here on this slide, you can submit an application at any time. It also means you're not required to submit the recertification application every 3 years. So a little bit of a perk. So here's a quick rundown of the requirements to be an NHSC approved site. Again, you do have to be in a federal HPSA designation. You do have to provide comprehensive primary care services and have a no discrimination policy. No one can be denied care due to their inability to pay. You would need that sliding fee schedule for folks who are 200% of federal poverty level below. You need to have a recruitment and retention plan, and that's what the STAR Center is here for, to help you all with those recruitment and retention plans. And there's lots of resources on the STAR Center website to help you with that. And obviously you can reach out to anyone from the STAR Center as well for TA around that. And then also you'd want to be connected to the National Practitioner Data Bank, or the NPDB, to credential clinicians, but it's also a way to search for clinicians and see if they've had any issues in past jobs. Probably a lot of you have heard of this. I did want to add that you do have to have a certain HPSA score depending on the type of discipline, clinical discipline you're trying to hire. So for example, I believe you have to have greater than or equal to 20 HPSA score for physicians or NPs in the primary medical care HPSA. So they do update those numbers every year, and actually I might go to, no, I can't. Well, maybe someone else could look it up and put it in the chat. I was going to try to copy it and paste it from my notes, but I can't do that. But I would check that out, see what the updated numbers are when you are looking to recruit some clinicians from the National Health Service Corps. They do have really helpful webinars on filling out these applications. I participated in them. They're extremely detailed. So definitely sign up for them if you can. And again, lean on your state primary care office. But would you add anything here, Amanda, about the state PCOs?
No, I don't think so. I think the one thing that I will recognize is that PCOs are sometimes, and PCA, I think all of us, it's sort of like you've seen one PCO, you've seen one PCO. And so that has to do with resources, and it has to do with staffing, and it has to do with a lot of different factors. But I think that it's often an underutilized relationship, sort of regardless of where they rest in that space. So I don't, we probably sound a little bit broken record on like, talk to your PCO, but it's valid in so much as I think there's an eagerness to help and be engaged on their part. And I think sometimes I will say, even on the ACU side, like I think sometimes we're so used to working within our circle and our community that we don't think to engage there. But once you do, I think the benefits are very obvious. So just another plug, just one more plug.
Yeah, I mean, even when I attended the HRSA webinars, they said that the whole time too. Reach out to your state PCO. So everyone's going to tell you to do that. Oh, sorry. So how do you recruit NHSC clinicians? So I did mention the connector site, but there's also the customer service portal. So this is when you're already approved as a National Health Service Corps site. You can go on the customer service portal, and if you go down to the bottom, I don't even know if you can see it, but it says site point of contact representative or PCO. That's where you would go and start looking for National Health Service Corps clinicians who are in the program and ready to work for you. Then there's also virtual job fairs. This is also a link over here on the right. So when you get the slides, you can click on that. And then also there's a really helpful link down here at the bottom, how to recruit, hire, and retain clinicians. There's really helpful information there. I will mention here, I think, and I'll get to it in a minute too, actually, the next few slides, but you do want to make sure you have a really great support system for those clinicians when they do get there. Actually, this is just a great transition into the next topic, but the National Health Service Corps conducted focus groups in February of 2020, and they wanted to talk to current, former, and future scholars and SS loan repayment program participants about the program to see what worked well and what could use improvement. And so I'll get into that in a few minutes, but I wanted to ask you all, what challenges have you seen at your sites, or if you're a PCA, if you've worked with healthcare agencies, what kinds of challenges have you experienced when hiring and onboarding new National Health Service Corps clinicians? And feel free to put your answers in the chat. And it could be challenges around just looking for the clinicians, or once you get them at your agency, maybe around orientation or training them on certain services you provide or types of patients that you're serving. You folks are shy today. That's okay. All right. Well, I'll go ahead and move on, and I'll tell you what the participants thought was challenging, but also what worked well. So some strengths of the program they mentioned is that they got a really lot of good skill development in the program, seeing the diversity of patients and clinical and social issues that the patient populations experienced at those sites. They were obviously very happy to get the financial support from the scholarships and the loan repayments, and some of those rewards of just like serving people in historically marginalized communities, really appreciating the difficulties, the barriers to care that those folks experience, and how rewarding that work can be. Some weaknesses that came out of these focus groups is that some folks felt that there was a lack of standardized and comprehensive site onboarding. They felt like they wanted more guidance around the clinical issues and some mentorship too within those organizations. They felt like there was limited ability to perform certain procedures or care. They were only allowed to perform basic procedures. They also didn't anticipate the level of resourcefulness required to serve folks in health provider shortage areas and maybe historically underserved communities. And again, folks with lots of barriers to care. And also, some of them felt like the sites didn't really understand the National Health Service Corps program. And so really glad you all are here today to learn more about it and hopefully can really build those relationships with your state PCOs. But some folks really felt that productivity was being and profit were given priority over the quality of care. I think they were frustrated with the number of patients they had to see per day. And these kinds of issues are related to burnout. Not having enough time with patients, seeing too many patients a day, having different values with your organization can contribute to clinicians experiencing burnout. And then also it sounds like some individuals in the National Health Service Corps didn't feel like they were able to maintain their eligibility because the site didn't understand how to maintain that HPSA score. So again, another reason to really be in touch with your state PCO and make sure those HPSA scores are staying at the right place to be able to maintain the approved site status. So what were the training and TA needs that some of these folks mentioned in the focus group? They wanted more information around the social determinants of health. They felt like they learned about these issues in med school, nursing school, dental school, but they weren't really learning how to address them on the ground. And they weren't really familiar with the local community history, the needs, because a lot of times folks are going to totally new cities, new communities that they've never been a part of, and they're sort of like lacking that historical knowledge that would maybe help them provide better care to their patients. They wanted more information around the payment models, especially the government-run one, probably Medicare, Medicaid, more information around scheduling models, and really wanting those professional mentorship relationships. And then also learning more about practice models. And there was a recommendation from folks that if onboarding was improved and expanded, that might help resolve that issue. And just learning more about community-based care in general and interdisciplinary care. So I guess I wanted to ask you all, what about those responses resonate with you as folks who support National Health Service Corps clinicians? What do you think is missing, and how do you think some of those answers would change if the focus groups were conducted after the COVID pandemic began? It might look a little different. Are these the types of things you've heard from clinicians that you've had at your site who were part of the National Health Service Corps? I know someone is saying in the chat that for geographically small states, the HPSA score may be low due to the modernization project and can be prohibitive when applying for scholars. Amanda, I don't know if you want to chime in about that.
I don't have a lot to add, but I am really curious, and I see some of the feedback that you guys provide and sort of the experiences that you're having are really helpful in terms of guiding our work and how we can be most responsive. So I would just sort of reinforce that we want to hear from you, sort of all of the good, the bad, and the ugly, I guess is what I would say, and never ever feel bad about, if it's like, man, this is just really hard, or we keep striking out. Like, I think everybody's experience is a little different. But the goal is to make the absolute most of it, and for us to be able to create the supports and resources to help you guys in being able to leverage. But no, I mean, I certainly can share some of the things that I've heard anecdotally, Molly, but I want to be sensitive to time. So.
Oh, okay. Thank you. Yeah. Looks like we've got about 18 minutes left. So there is a question. Did the focus groups include questions on how members were informed about the National Health Service Corps? Increasing awareness to students has been a high priority. Yeah, I mean, I think that's a really good question. And then I have to go look back at the details of the focus groups. But yeah, it's very possible people aren't even aware of it. And something I've heard as well is there is I think, minimum of 40 hours a week that's required to be in the National Health Service Corps. And I'll say more about this later, but I know that some members think that the number of participants would increase if that number was reduced. I think some folks feel really burnt out having to work a minimum of 40 hours in really challenging work environments, and they think that it could open up the program to a lot more people if they offered some part-time options.
So there was another comment, Molly, from Joni about onboarding. She said the onboarding comments stand out to me. I'm glad that they are being asked this so efforts can be focused to address it.
I think that's, oh, thank you, Suzanne. No, I think that's a really great point. And I mean, kind of like Amanda was saying about PCOs and PCAs, meet one health center, you've only met one health center. I mean, they're all extremely different. The onboarding can be really different at each site. So you probably have really great onboarding processes at some of your health centers, but it is important for the ones that maybe have some struggles around that to really work on it so they can retain the clinicians. I mean, the whole point is to incentivize clinicians to work in places they might not ordinarily, but then they get to know the environment, the community, they have really good experience, good training, good supervision at their sites. Hopefully they'll want to stay. So that's really important. And onboarding is probably like the number one important thing when you start a job, is like, how well were you trained to do your job? How supported were you when you got there? That's really going to make a difference.
Sorry, Molly, I'm going to add one other thing. I am continually surprised at the number of providers that I talk to that just have no knowledge of the National Health Service Corps. They just don't. I mean, and I think that it's a little bit better when you're talking about those who might leverage the loan repair side, but really across the board, so I think there's a lot of education work that it's needed, but I think the onboarding piece for sure. And then the other piece that I would say is, like, sometimes there's providers that have been around for a long time and like they just don't know. They have no idea that they're eligible to tap into these things. So, I don't think that's anybody's fault. I just think it's, different stages in career and different needs for a lot of different reasons. But the other thing I would flag is that I know a lot of you guys, both on the PCA and the health center side, have relationships with different academic institutions and or other stakeholders in the space that are helping to sort of hopefully guide people in the direction of working in underserved communities at health centers and elsewhere. And so I think, like, just being really intentional and concerted about having those conversations with some of those stakeholders too, because I think there's a lack of knowledge on that side of it as well. But I don't know if you guys find this, but I hardly ever encounter someone who doesn't work in our world who knows what National Health Service Corps is. And it doesn't shock me the way it used to, but it does surprise me sometimes to talk to people inside our space that still are just like, I don't really know much about it, or they know just barely enough to know that it exists, but not what they might be able to do to take advantage of it. So just food for thought on that one.
I'm so glad you brought that up. I actually meant to mention it in an earlier slide when recruiting clinicians, but also when helping to retain the clinicians you have, and yeah, alerting your current clinicians to the loan repayment program. Such a great idea. And maybe it's as simple as putting up printed out information in areas where clinicians hang out frequently, like break rooms or where you have morning huddles, or just talking about it too in your however often you have meetings, in your weekly staff meetings or newsletters. So thank you for bringing that up. So the whole reason I mentioned this focus group is because it's what led to the National Health Service Corps Empowering Clinicians for Resiliency and Transformative Care Initiative. So what they did with those focus group answers is put out a contract, put out a request for proposals to basically develop educational materials, a curriculum for members of the scholarship program and the Students to Service loan repayment program to really help them understand how to provide care to folks in underserved communities, help them be more culturally competent, understand the root causes of health inequities, and really promote that clinician wellness and burnout piece that so many of our clinicians are experiencing now. So APT Associates got that contract, and ACU subcontracted with them on this project. And in the last year, we developed, I believe, 49 resources on these topics. And we're now implementing webinars to disseminate all of the materials that we have developed. Again, it's just for the National Health Service Corps scholars and the SSLRP participants. And that's because they really wanted to focus on the folks who are just coming out of school and are very new to practice. But the areas that we've been focusing on, again, is provider wellness, organizational resiliency. So it's not, we don't just talk about what clinicians can do to avoid burnout or mitigate burnout, but what organizations can and should be doing to really support their clinicians, changing policies and structures to make more supportive work environments. But we go into health inequities that different subpopulations are experiencing, how to measure those inequities, the data sources to even look at to do that within your community or with your organization, and then how to address inequities that you do find, and using community partnerships and advocacy to do that. And then also looking at the social determinants of health, that of course, so like racism, sexism, ableism, all housing status, all of these things that impact individuals' health. So our schedule events this year, we just started in February. If you have clinicians who are scholars or SSLRPs, they are getting emails about all of these, and then all of your site points of contact should be getting emails about all of our webinars and resources that we're disseminating this year. So right now, we're in the middle of series 1 on clinician well-being and self-care. And we'll be finished with that series in March, but it's 5 webinars, 4 executive summaries, 8 infographics. So there's a little screen grab of one of the infographics on why do clinicians experience burnout? Like, what are all the factors that are related to that? We've also got information on burnout, self-assessment tools, coping strategies. And at the end of March, we'll have a really great grand rounds from a former National Health Service Corps participant who was experiencing burnout and advocated for changes in his health center. And now he's the Chief Wellness Officer of Equity and Wellness. So he really did a lot at his organization to make changes. And we want to inspire our clinicians and our sites to make changes in their organizations for the betterment of all the clinicians. The next series will be in April to July. And this is all for the organization. So we are talking about fostering resilience at the organizational level. What can you all do at your sites, and what can PCAs help talk to health centers about that they can do at their sites to create those supportive environments? So here's an example of one of the infographics we have on 10 ways to support a clinician during crisis. So we do also focus on supporting clinicians during a public health crisis such as COVID-19. but making sure we're prepared for those crises so we're not scrambling when the time comes. And then when we got a big compendium of resources that we'll be putting out in April to help organizations do that. And then the last series is on health inequities and social determinants of health. That will be August through October. 7 webinars, a community assessment guide around how to look at that data and analyze it and pinpoint where the health inequities are, and then how to address them, again, with community partnerships. And sorry, lost my train of thought. Community partners and advocacy. So it could be advocacy within your organization, at the community level, even at the national level, maybe joining professional, like clinical professional groups to do advocacy on the national scale. And then lots of great infographics around, and I forgot to add, there's some executive summaries in this one too, around the different social determinants of health. So here's an example of one of the infographics on the neighborhood and built environment, but we'll also talk about healthcare access and quality, social support, and so on, food insecurity. It's a really great program. And how can you all get involved? Well, we would love if you encourage your National Health Service Corps clinicians to participate in the webinar series and utilize those resources that we've disseminated. They can access some of those resources in the National Health Service Corps portals, and also the site POCs can as well. But again, it's just for scholars and SSLRP participants. We're hoping that can be expanded at some point, but right now HRSA really wants these materials to be exclusive to those 2 National Health Service Corps programs. Also, please assist your site POCs in identifying the appropriate participants for the organizational level trainings. And one way to do this is to update your site point of contact list. And actually on the National Health Service Corps website, there's a way for you to do that. If you're already a National Health Service Corps approved site, you can update that POC list on your own. And then this is a clickable link here. You can provide links to folks in your organization to join the mailing list. So even if they're not already a site POC getting these emails, they can sign up and get more information about our upcoming webinars and all the resources that we're putting out as part of this initiative. And then finally, we would love if you want to send us speaker recommendations. We've not confirmed speakers for the series and webinars that are further down the road. And also this is the first year of 4 where we're basically going to replicate the same curriculum. So we'll be constantly be looking for new speakers throughout the years. And we would really love it if you send us recommendations of clinicians at your organizations who have been part of the National Health Service Corps. It's really helpful for people who are currently in the Corps to hear from former members and hear about their experiences. They really appreciate that. And I will add too that a lot of the webinars include a networking component. So some we have breakout sessions by affinity groups. So like clinicians who are in the Corps, and then the site staff, so like leadership or HR staff. And then the one coming up on March 1st is going to have a coaching session. So we've had a couple webinars already. The next one is on March 1st, and it's on coping strategies. And we'll have a certified coach talk a few people through challenging scenarios around coping strategies. And then just something to think about as you're leaving this webinar and go back to your work, but what could you implement right away at your site to increase the number of clinicians you're recruiting from the National Health Service Corps, or ways to better support those individuals at your organizations? PCAs, what can you be doing to support health centers and developing their applications, or maybe working on their HPSA scores, or developing those recruitment and retention plans, and what conversations will you need to make those changes, and then who needs to be part of those conversations. I think I will stop there. Thank you all so much, and thank you, Amanda, for helping me out today. Contact info if you need it, and then questions, if folks have any.
Absolutely. Feel free to, excuse me, put your questions in the chat. There's been some definite dialogue in there, and so really appreciate you guys, your involvement and your engagement in this. Also want to thank Molly and Amanda for joining us today. Although we are colleagues, we don't get to work together in this type of capacity very often, so it's really fun to be able to have this come together. Our work is always parallel, but when it crosses like this, it's really awesome. So really appreciate your insights today and talking all things National Health Service Corps and HPSA scores and all of that, because I know there's often so many moving parts. And it's great just to hear it, even if you've been involved for a while. It's really great to hear it. And also enjoyed learning and hearing about the initiative that Molly and her team are working on. Next slide, please. So just wanted to, as we wrap up here, just wanted to let you guys know that our fourth and final session in the series is coming up 1 month from today, 4 weeks from today, on March 16th. And we're going to have another one of our ACU colleagues, our Senior Director of JEDI Initiatives, Sabrina Edgington, is going to be on, and she is going to be presenting a webinar called Representation Matters, Diversity, Equity, and Inclusion Among Healthcare Professionals. So you don't want to miss that last one in our series. Next slide, please. And so this is just a link to sign up for our newsletter if you haven't already. There are some couple things in the chat that are coming out from the STAR Center, so feel free to do that. With that, that's going to wrap up our session for today. Always feel free to reach out to us. You'll have Molly and Amanda's contact information in the slides. Feel free to send us an email at info@chcworkforce.org, and we'd be more than happy to, answer any questions or TA, as Molly was referencing earlier. And so with that, again, thank you everyone for participating today, and again to Molly and Amanda. And I believe Mariah is now going to launch our evaluation, and we would really appreciate if you guys would give us feedback there. So with that, complete the evaluation, and we'll see you back here next time in 1 month for our next session. Thanks everybody. I hope you have a great afternoon.